Hello, everyone, and thank you for joining me here again today at MG Matters 2.0. As you know, this is where we talk about lots of things that are important in the care of patients with myasthenia gravis. I'm Pushpa Narayanaswami, and today we are going to talk about the role of the nurse expert in the management of patients with myasthenia gravis. And in order to do this, I have with me two nurse experts. I have with me Amy Perrin Ross and Jerrica Farias. And I would like to have you introduce yourselves.
So yes, as you said, my name is Jerrica Farias. I'm a nurse practitioner. I work at the University of South Florida in Tampa. I've been a part of the neuromuscular division there for the last 8 years. So I treat patients with myasthenia gravis as a clinician, and I'm also involved as a sub-investigator on our clinical trials.
Yes, I'm Amy Perrin Ross. I'm the neuroscience program coordinator at University Medical Center in the western suburbs of Chicago. Been doing that for many years, and I see primarily patients with multiple sclerosis and myasthenia gravis.
It's great to have you here today. So, Jerrica, can you tell us a little bit about how one becomes a nurse practitioner and what's the difference between a nurse and a nurse practitioner?
Sure. So in the United States, there's several kind of levels of nursing. The education for a nurse practitioner is to have a bachelor's degree in nursing and then to go on to have a postgraduate degree. So that can be a master's or a doctorate. And so you would, complete your education, and then you also have a certification exam.
And how does the work of a nurse practitioner differ from the work of a nurse?
Well, it really depends on where you're practicing. If you're practicing in North America, US and Canada, the nurse practitioners have, in most states, a very wide-ranging role. They do everything from carrying independent caseloads, seeing new patients, but many of us actually work with our physician colleagues in partnership, seeing return patients and doing a lot of long-term patient management, particularly with chronic disease people.
Great, and that's a perfect segue into my next question for you, and you may as well take it away, Amy. So where do you see the role of the nurse or the nurse practitioner in the care of patients with myasthenia gravis?
I actually am a big believer in the concept of the comprehensive care team. I believe people with myasthenia gravis deserve a comprehensive care team behind them. Doesn't mean they need all members of the team at every visit or at all time, but they really should have access to nurses, to physicians, to physiatrists, to pharmacists, social workers, so that if and when they need those people, they have a route to get to them and are not really left out on their own. That being said, very often it is the role of the nurse to be the care coordinator in the team. Looking at it from a nursing model, we look at the nurse who helps establishing care with our patients, where the nurses will work with the patients early on in terms of identifying the diagnosis, helping them accept the diagnosis. We then move into continuing care. We talk about treatment, and we're increasingly becoming aware that there are newer and newer treatments becoming available for people with myasthenia. And I think it's the role of the nurse to help those patients navigate and become involved in shared decision-making to make sure that the patients are part of their own decision-making and their trajectory on how they're going to live with MG.
Right.
When I see patients in the clinic, oftentimes we are discussing treatment options. I'm helping them understand the pathophysiology of the disease, help them understand what's happening in their bodies. As far as, treatment options, I try to kind of give them the entire landscape of the treatments that are out there and discuss why I think some are more appropriate than others and help guide them to a mutual decision. A lot of times I say, I'm here to be a menu for you and give you the benefit of my experience and what I think it's most appropriate, and give them the information that they need to come to the right choice.
And I think that's really valuable because I'm sure you spend a lot more time than is available for some of your physician colleagues to do that. And, that sort of gets me, I guess, to the next question, because you were saying you talked to them about all of these treatments, but I'm sure you play a role in monitoring too, because many of these treatments, as we all know, they have regular monitoring, blood work or other monitoring. So what training did you have to get? I mean, you've been doing this for 8 years, I think you told me.
Yeah.
So what training did you have to get to understand, myasthenia gravis, and of course, as time goes and things change in terms of diagnostics and in terms of therapies, how do you actually keep up with that?
So what you get from nursing school is incredibly limited, to be frank with you. So I had the benefit of working with a great physician, Dr. Vu, and he took me under his wing and trained me for 6 months before I was practicing, with any modicum of independence. So I think that was pivotal. There was a lot of reading articles, guidelines, best practices, a lot of, on-the-job training.
Yeah.
Since that time, I've been able to attend a lot more conferences and, CMEs to the extent that they're available. But, we got a new physician's assistant last year, and I got to be part of her training. And it became so apparent to me that we need to have a standardized curriculum, because the role of advanced practice nursing and physician's assistants is only going to increase in the future. The truth of the matter is our population is growing. We're getting better at identifying these diseases, and the number of physicians that we have just can't keep up with it. And so the more highly trained advanced practice providers that we have, the better off that all of our patients will be.
Absolutely. What say you, Amy?
I have to agree 100% with Jerrica. There basically was no MG training, either in my basic degree or my advanced degree. And I, like Jerrica, had the benefit of a wonderful physician mentor who encouraged me to look at the myasthenia patient from a very comprehensive perspective. And this was many years ago. I now have the benefit of working with some neuromuscular physicians who, again, are very interested in the comprehensive care team. We do things like journal clubs and talk about myasthenia novels or journal articles for our learning, but there really is no formal curriculum.
But what you're saying is that you're part of that team, and part of that teamwork, by the team leader or the clinician or whoever it is somebody that takes a responsibility for teaching and for keeping that teaching going, because that's, again, key, because things are changing so rapidly. You said that the role is only going to increase. So where do you see that going? What do you see being different in your role with all of the new drugs and all of the new advances in diagnostics coming up?
Sure. So, the depth of knowledge that there is in neuromuscular medicine, not just myasthenia, but all the diseases that we treat commonly, is getting, deeper and deeper, and the learning curve is getting steeper and steeper. So I do think that in addition to doing better training of our, advanced practice colleagues, we're also going to need to put more efforts out as far as doing better training with our, LPN and MA staff, and empowering them with more knowledge so that, quite honestly, they can help with some of the educational materials, because, the more well-educated points of contacts that our patients have, the better off that they'll be.
Yeah, and so you're sort of increasing your care team just to help patients and help all of these extra steps that have to happen. What would you add to that, Amy?
I would actually add something that it was brought to my awareness by Jerrica in preparing for our discussion here. Jerrica reminded me of the role of the nurse as advocate, advocating for our patients, whether that's advocating for access to treatment, advocating for a second opinion, advocating for workplace accommodations if that's something that's needed. Certainly, as we've heard today, advocating for mental health resources for our patients, and also being a resource to our patients to help them learn to advocate for themselves.
Yeah, I do think patient advocacy is such a big part of what we do. And the more folks in the care team who are involved in it, there just isn't enough that you can do. I mean, it's different levels, it's different at different times, but it's part of that everyday care. That was great, and thank you so much for being with me today on MG Matters.
Thank you.
Appreciate it.